So now we wish to launch this facility, maternity block, in the...
This is an untold story.
Being monitored, yes. Delivery.
Yes.
Here in Kenya, we still have women dying during pregnancy, during delivery, or immediately after delivery. And also newborns dying because of preventable causes. So we encourage 100% attendance to antenatal care. And I'm happy, I'm told, in Makueni, I think you are setting a very good example. Because I was told the whole of this year, there has been no maternal deaths. Piga makofi, county government.
Tungependa kutoa shukrani zetu kwa dhati kwa His Excellency the Governor wakishirikiana na National Government kupitia kwa mradi. Ile hospitali nimeona pale, hiyo iko kiwango ya juu, sijui ni Aga Khan ama ni Nairobi Hospital, hata unaitwaje huko, hata Machakos level 5 haika hivyo. So thank you. Hii ni standard iko juu na hiyo ndio inataka watu wa wapi wa huku kwetu.
We are number 29 in the country. Basically 53% of the population are registered with the SHA. Around 530,000 people have registered with the SHA. Significantly is that the women of this community have taken their healthcare a little seriously than the men. So women are around 294 and the other percentage is the men. So as the son-in-law of this soil, I would want to ask my father-in-laws to pull their socks.